Oftentimes patients come in to see us for body contouring, and one of the main decisions that we have to make is, are they a candidate for a tummy tuck? Are they a candidate for liposuction? Or are they a candidate for a lower body lift? A tummy tuck is also called an abdominoplasty, and oftentimes it involves removal of the excess skin and fat in the lower abdomen, reshaping the abdominal wall musculature that have separated as a result of pregnancy, and then moving the belly button to a new location. Sometimes it involves a little bit of liposuction to feather the sides and the incision. I recommend a tummy tuck for patients that have had pregnancy, postpartum women who have had diastasis and separation of their abdominal wall musculature, as well as stretch marks after pregnancy. Oftentimes with a tummy tuck, we're able to remove most of the stretch marks and bring the muscles back in the midline to recreate a six-pack abdominal wall contouring. A tummy tuck procedure is not an option for patients that don't have diastasis or excess skin. In those situations, we're more likely to recommend liposuction since we don't have to do any work on the abdominal wall musculature. Other times, the patient have lost a significant amount of weight that they have excess skin not only in the front but also in the back. For those patients, we often recommend a lower body lift, which involves a tummy tuck from the front as well as a lift of the buttocks from the back. And those patients often require 5-6 hour operation, more extensive than a regular tummy tuck. I also recommend a tummy tuck for older patients that have laxity in their skin, that have developed excess skin in the abdominal wall area below the belly button. Those patients that lose a lot of weight as well have developed the same kind of problem of excess skin below the belly button. Those patients do very well with a tummy tuck. When the patient comes in for a tummy tuck consultation, we often listen to their concerns and decide whether a tummy tuck is the right procedure for them or not. We often have to decide whether they have a medical condition that would allow for a procedure like a tummy tuck. Once we make that decision, then we schedule the operation in an outpatient surgical facility. That surgical facility is an accredited surgical facility off campus on the hospital campus. The procedure is done under general anesthesia and it takes about 3 hours. We start with an incision from head to hip and then we dissect all the way down to the abdominal wall. The skin is elevated and separated from the abdominal wall to expose the underlying muscles that have separated. With a corset suture, we're able to bring the six-pack muscle back in an anatomical normal position in the midline. And the belly button is made in the middle, and then the skin is closed very carefully to make sure that you get the best possible surgical scar. Sometimes, at the end of the procedure, if we feel the patient is a candidate, we can add and combine liposuction, especially in the area of the flanks, to create a better body silhouette. Once the procedure is done, we often place some drains. Sometimes we're able to do it with drainless tummy tuck, without placing drains. And the patient is sent home on pain medicine and with an abdominal binder. The patient is seen in the office 1 week, 2 weeks, and 6 weeks postoperatively. During those visits, we'll decide on removing some of the drains or all of the drains. Further instructions given about what level of activity they should be doing. For the most part, the first 2 weeks, they're walking a little hunchback. And at 2 weeks, they're able to walk up straight. And at 6 weeks, they're able to return to normal activity and start the exercise program again. I tell patients that they're going to require 2 weeks off of work whenever they're considering a tummy tuck. Some patients may require less, some patients may require more. 60% of the healing is over and done with by 6 weeks. And then the rest of the 40%, people will experience healing for up to 6 months. The results and the outcome of the operation depend mostly on following the instructions that we give patients before, during, and after surgery. If you're looking for a smoother abdominal wall contour and less skin in the lower abdomen, it may be time to consider a tummy tuck. At Westfield Plastic Surgery Center, we'll make sure you get a great outcome.